Hi, welcome. I'm Dr Khaled Sadek and you're watching my fantastic YouTube channel on cysts and lipoma removal. Hi everybody, welcome. It's me, Dr Khaled Sadek. I'm in a very special location today. We're outside Battersea Power Station where they're celebrating the launch of this massive, monstrous power station. And they've got all sorts of events going on. Now have a look, they've got water features here. They've got a lady with her hula hoops. They've got a band playing, which you missed. They've got a hula hoop lady over there. And over there on the pier, there's a party going on. Look at the lights going on there. Check out this hula hoop lady. Wow, check her out. Is her hula hoop magic better than my lipoma removal technique? I think she's got it in the bag. A total winner. Check it out. Wow, totally stunning. Now, remember to follow, subscribe, like, share, press the alert button, comment, and most of all, enjoy the video. Until next time. Bye bye. You starting? Do you have it? Okay, fantastic. Filming. So just gonna give it a bit of a clean. Okay, disinfect the skin. And what we've got here, you can see, is this cyst just underneath the skin. So what I'm going to do is just put some local anaesthetic in slightly into that cut. Sorry, fantastic, okay? Hi, welcome everybody. I'm going to be doing some narration on top of my audio during the procedure as well, just to help us understand what's going on as we go along. What I'm going to do is just rub that into the local area. Okay. I'm getting a good bird's eye view there as well. What I'm going to do is just put a drape over you as well. See this green drape being placed on. This is the surgical drape. It's sterile at the top, and it's there just to maintain a sterile field and reduce infection risk. What we've got here is a very small cyst on the left side of her eye. And what we're going to try and do is remove it. So we're going to make a small incision. We don't want to have a big scar, so we have to make a very small incision to get access to this cyst that's underneath the skin. You've of course got to be very gentle and very delicate when operating anywhere near the eye, because the last thing you want is any trauma to the eye. And also the face is a very visible place, obviously, and so you want to make sure that any surgery that is done there is very small. You can see that some of the fluid has actually squirted out when we press the cyst. Often with these kind of cysts, they are deep inside and there's a lot more sebum or keratin or cyst content that needs to come out. And so we just need to make sure that's all out. Sorry, darling. You're doing very, very well, okay? And there we have a bit more of the cyst content coming out of the skin. And hopefully this will enable us to get access to the deeper sac. These are the artery forceps, and what I'm trying to do is gently get a hold of the sac. That's the thin-walled bag that's holding the content, and just gently with the swab push away the skin with some blunt dissection. Got to be very gentle so that you don't destroy the whole sac by pulling too hard, and then just gently push away the skin away from the sac while putting some light traction on the forceps. You've got to be very patient while doing this procedure. What I'm doing is I'm just gently dissecting the skin and the tissue from the sac, very, very gently, because it is so very, very delicate. As I do that, you can see the sac just coming up to the surface from my end. I'm not sure if Mum can see that. I want to just try and get now another bite on that. Do you want to take it?
Mm-mm. Is that okay? Mm-mm.
Doing very well, Elif. Just be patient. So if you look closely, you'll be able to see that the sac is coming up to the surface. It is very small, admittedly, and maybe the cameraman should have zoomed in a little bit better, but hopefully you can get an idea of how delicate this procedure is, especially when working on the face. Doing fantastic, Ella. Hang in there. Hang in there. Don't give me no. Quite yet. So, what's going on in Turkey these days? What's the news? What's Erdogan up to? What's he up to? Has he lost Parliament yet?
Yeah, he's lost it.
He's lost Istanbul, didn't he? He lost Istanbul. Okay. Better not put that up online, actually. I might not be able to enter Istanbul again. Because the incision is so small, I suspect once this sac is out, that no further stitches will need to be placed in, and the skin will heal very nicely. So it doesn't reoccur. Can you see what I'm doing, Mum? Mum's fallen asleep. You alright? Sure?
Are we done?
Almost. What did you do to your clavicle?
Oh yeah.
Break that.
I don't have one.
Oh, what happened? A car accident or something?
Similar. I think I've got so many scars.
You alright? Too painful?
That's fine, alright.
It's just flat. Okay. It's nice things that okay. You alright? Well, that's best I can do. I think I got the sac out in total, but reoccurrence is a risk. That's just scar tissue at the top there. The question is, I think what I'll do is just steri strip that. Okay. Are you feeling alright? Okay. I'm going to put a stitch in. I'm going to just steri strip it, bring it together with dressing. Okay, there's quite a small hole and I think we can bring it nicely. That's it. Okay. Alright, you can finish. That's great. Hi, I hope you like that procedure. Remember, if you like the video, put a ring on it, subscribe down below. I'd love to hear your feedback about diversifying the program. Remember to tell your friends about it. And most of all, till next time. Bye bye.